Hi, this is Wendy. Thanks for joining us on the Praying RDH. I am joined today by Dr. Brooke Means, an audiologist, and I had the pleasure of getting to know Dr. Means with a group. We both service our community in a healthcare capacity with a specific interest in seniors. And a lot of what I hope to do with the praying hygienist is to really focus on that integrated healthcare to help remember that the body is a part of the mouth. That the mouth is a part of the body. And also for hygienists to remember that we can be a good line of defense and a good kind of help identify other things, healthcare needs that our patients might have. So with that intro, I would like to introduce you guys to Dr. Means.
Thank you so much. That was a great intro. I feel exactly the same about the ears, and that's why I really enjoy the group that we're both members of, so that I can collaborate I feel my patients, as a whole, not just the ears is what I'm looking at. So, but I think we're here today to talk about the ears a little bit. Maybe hearing healthcare is what I do and what I love. And I'll tell you just a little bit about me. I have a younger brother who's 5 years younger than me. He was actually born with multiple disabilities, special needs. And part of that was hearing loss. And so he actually started wearing hearing aids when he was 2 years old. And from after that, a few years later, he received a cochlear implant. So I always like to say to my patients, I've been on the other side of the table as far as the family side, the decision side, the trusting in your professional side. So I've been around audiology pretty much my whole life. And I really love it. It's my passion. A lot of the times talk about hearing loss, and I like to start off with a little game. So do you mind if I do that little visual, Wendy?
I think I've seen it. I would love, I would love for you to share it.
So I always start off with kind of let me see if can you see this okay?
Yeah, we can see it.
This little representation. So it's missing some letters, as we can see. And then if I have a room full of people, we try to guess what the sentence is. And it's difficult when you can kind of see parts of it, but not all of it. It's challenging. And this basically represents how hearing loss can be. It just, when you have hearing loss, it doesn't mean that you can't hear anything. It doesn't naturally just mean deafness, we call it, but it can mean that you're just missing out on parts, or we refer to it a lot as I can hear, but I can't understand. So this is a sentence. I promise I'll tell you what it is in just a second. But I'm going to show you the same sentence in a different form, which represents a different type of hearing loss. So here's this. And then that one's a little bit easier to kind of piece together. So we're looking at, how are you doing today? But as we were saying, when one of the most common type of hearing losses cuts out a lot of the consonants. It's called a high frequency hearing loss. And when you can't hear the consonants, it's hard to understand any of the words, put together the meaning. So basically, I relate hearing and vision a lot, because a lot of people put those things together. This is the good classic eye chart. So if you have normal vision, or we're going to represent that as normal hearing, you have the full scape of all the information. Mm-hmm. But with vision impairment, generally, it makes it more difficult for the lower or the smaller, the letters at the bottom. But with hearing impairment, it's quite different in that it may be all over the place, the different things that you're missing, and it can definitely be very different for different people. So that's why I find hearing impairment interesting. It's challenging. I think it's more complicated than what some realize, that it's not just a one size fits all. And that's what I've made my goal, is to individualize hearing care so that everyone gets their best treatment possible. Do you want me to speak a little bit on signs of hearing loss or related conditions or anything like that, like we were talking about?
I think that would be really good. I think that's good for both anyone that's listening that is just an allied health professional between each other, like something a hygienist might notice. And also maybe like a spouse or a child of a loved one that is having hearing impairment or hearing loss, helping us better recognize what we can be looking for or listening for, I should say.
Sure. Yeah, both, all of the above. So some of the most common signs, which one thing I say almost every day, is it's very hard to see or to hear or notice, I guess we could say, when you have hearing loss yourself. I typically say to people, how can you know what you're missing? So most of the time, the people around us, our family, our friends, our healthcare professionals are the ones that sometimes notice it more quickly than we do. Some of the signs that you may hear people saying is, I hear, but I don't understand. That's a very classic one. Things such as, well, I can hear everyone except for women or children. That's a common sign of or indication of hearing loss. There's some other signs you may not think about that could be associated, which I think you probably see this a lot in the dental world, is tinnitus or ringing in the ears.
Yes.
The most common reasons or causes for hearing loss, besides drug related, medication related, would be either TMJ disorders, which would be your side of things, or hearing loss, which is my side of things. So 9 times out of 10 for my patients, when they come to me for ringing in the ears, they do have hearing loss. And the first step of treatment is to treat the hearing loss, fill in the gaps, and then we can provide things such as sound therapy to help mask the sound and retrain the brain. And if they don't have hearing loss, then I can refer to our dental friends to make sure everything is good with the teeth and the jaw.
So can you describe more of that? How does
Yeah.
the TMJ affect the hearing?
So the TMJ doesn't necessarily affect the hearing, but the dysfunction in the joint can actually cause pain. It can radiate pain to the ear canal because it's in the same area. But with the tinnitus, it's just a sign of TMJ disorder. Oh. Yeah. And I don't know the mechanics behind it, other than when I screen the ear and it's not the ear, then I say, have you seen your dentist? Because I know when I go to my dentist twice a year, and they always check all that good stuff and ask if it's bothering you. So I don't know what they would do for it exactly, other than a
but
brace.
When we fix the TMJ on the dental side, it helps with the tinnitus on your side.
Exactly. It can. And I would assume a lot of that has to do with the stress to the system, the stress to the body, the stress of the muscles and all that's involved. Because on the hearing side of things, when we fill in the gaps of hearing, if you're still perceiving that tinnitus or tinnitus, some people say, a lot of the times it's highly related to stress, internal stress, like your fight or flight response. And that's why I say we try to retrain the brain, because we're basically retraining how our brain's thought process towards the tinnitus is.
Wow. And yeah, I remember you sharing a story about an individual that you helped with that side effect, that symptom. And I think it kind of relates to a lot of the message that I'm also hoping to achieve with the Praying Hygienist site, is that, when we show up to work, we're changing lives if we put our all into what we're doing. Kind of that practice at the full scope of what you have to offer, and to really pay attention and have that service mentality for each person that you're caring for. And I've had situations where I've helped people that it's amazing. You come to get your teeth cleaned. You're not expecting for somebody to have an impact on your overall health in that way, or to, have a broader reach than just walking away with clean teeth. I know you shared a story about an individual that came to you with that, and then you ended up changing his life. Can you share that with us?
Sure. Yeah. I'm bound by HIPAA compliance, as you are very aware.
Oh, yes.
That this particular individual was an emergency room physician. So when I helped him, I would like to say I helped many others because of what he does on a daily basis. So as you're saying, we do what we may feel like is one small thing, but it can have a huge impact. So tinnitus, I say daily, it doesn't matter as much what it sounds like as how it's bothering you or how it's impacting your daily life. Because this is a sound that basically stems from the brain, sometimes we may feel that we can't control it. And that can spiral into really bothersome matters that can even make us suicidal. Just feel like I can't control this thing that's inside of my head, and if I can't do anything about it, why do I need to be here? Basically, so when we like you're saying, look at the individual and what can I do to help this specific need, then I know what's most important to them. And sometimes it's not about the science or the technology or the research, is about talking them through it. Counseling is a big part of my job, just probably yours as well, just kind of educating and teaching, which doesn't seem on the front that would be a large part of it, but just talking through the process and then using the technology that we have, such as sound therapy and hearing aids, impacted that individual so much that he did not hear his ringing in the ears anymore. And he says it saved his life, which I believe, because I've seen so many people that it's such a big deal, and it can be that it feels like there's no way out. So yes, that was definitely a wonderful experience.
Well, thank you for putting so much of care into what you do. I know that sometimes we get a little bit timid as healthcare providers to stay within our box, to stay within our area of expertise. But I would compare this relationship between dentistry and audiology to similar as to when I see we pay attention to everything from the shoulders up, is what I say. I'm looking at it all, especially in this zone up here. And if I see something on somebody's skin that looks like it could be a precancerous lesion, I am not a dermatologist. I cannot say for sure if that is cancerous or not, but I've been trained to recognize what's abnormal. And at that point, I should make a referral. I should say, make the person, ask them how long it's been there. And then my next question is, do you have a dermatologist that can take a look at this? And I think that this kind of leads into a conversation that could happen chairside, that if somebody is talking about tinnitus, or we notice that they're not hearing us. Now, granted, I meant with the mask, we can be hard to hear, but if without the mask, or if we're talking louder and we still notice they're having a hard time to hear, I think we got to kind of stretch ourselves as providers to have a little bit more of a uncomfortable moment of stepping outside the box for the chance that we could help this person more, by encouraging them to go seek care from an audiologist or a dermatologist or whoever that person might be, the other healthcare provider. So I know from this conversation, I'm going to be more proactive in asking that question. Do you have an audiologist? If they say, oh, I can't hear you. Oh, I can't hear, I can't hear you because you're a girl or a woman or whatever, that could be a perfect opportunity to go like, oh, well, that actually could be a certain type of hearing loss that an audiologist could help you with. Do you have one that you can speak with? And then we can make those referrals. So, and then the whole TMJ thing, I'm definitely going to start having that follow-up question. In medical, we always can put notes on the medical history, kind of asking questions that could lead into other conversations, such as the ringing of the ears. That could totally be on a dental medical history. So awesome. Well, any other tidbits of information that you think that just the general public or other healthcare providers could really benefit from or need to hear?
Yeah, I was just thinking when you're talking about this kind of the whole body approach. I refer often, there are certain patterns or certain types of hearing loss that indicate potential heart issues. And I know that can be a thing with the teeth as well, how certain body parts are just so interrelated I'll say a lot, the ears need blood flow just like every other organ. So that's another thing, assuming that maybe they have heart issues, or I've sent people to, when's the last time you had your physical? When's the last time you saw your primary doctor? And they found heart conditions based off of a hearing test, which I think is pretty neat. But then I know from what my dentist has said, maybe they have, dental issues as well. I know that can be related. The ears can be related to kidney disorders as well. So you're completely correct on just viewing the entire system as a whole. And dementia is another big one with hearing. We know that use it or lose it with any body system. The longer you go without using or stimulating the senses, the weaker the brain gets at processing that sound. So that's another thing. If you see any kind of signs of memory or cognitive decline, that is very, there's a high correlation with hearing impairment in that population as well.
So if we don't want to have all of those horrible, we see it all the time with doing the dental cleanings for seniors,
right?
Just how hard dementia can be. So you're saying that if we're taking care of our hearing, making sure that we keep that at an optimal level, that actually is going to help our cognitive function.
Absolutely. It reduces the risk. There's a Lancet study. I usually show this in my presentations as well, that shows across your lifespan, what are different things that you can modify about your lifestyle, whether it's, eat better your eating habits, stop smoking, treat your hearing loss, different things like that. Things that you can modify that reduce your risk of dementia. Of this study, it found that the one that reduced your risk the most was hearing loss, correcting your hearing loss, which makes my heart happy because I've been saying this for years. But basically, this one right here, this bubble is 9%, and that one is hearing loss. It's hard to see, but
wow.
So actually, it's not a direct causation, but basically back to the use it or lose it thing. A more recent research article published that not only does it keep the brain matter stable, we've seen improvements after using hearing aids, properly stimulating those areas of the brain that are responsible for sound.
Wow. Oh my goodness.
Yeah.
Even more reason to pay attention. Because I think a lot of times people just discount it. Oh, that's what happens when you get older, right? Just like they discount their mouth. Oh, you lose your teeth when you get older. Oh, everybody ends up with dentures. Not true.
Right.
You don't have to.
Exactly.
Same thing. Oh, we just lose our hearing as as you get older. So yeah, no, we got to preserve this. And it'll help us keep our mind too. Keep our mind working. Awesome. What was you mentioned something about the kidneys. Can you explain the kidneys related to hearing?
Yeah, it's amazing. The human body is amazing. So the ears and the kidneys are actually developed at the same time in utero. So as we're forming as little humans inside of our mommy's belly, they're developing at the same time. So a lot of the times, if the kidney's not developing properly, that's affecting the ears, or vice versa at the same time.
Wow.
Especially earlier in life. Yep. So they're linked.
Yeah, we had to take a human development course back in school, and I'm like, forgot that detail.
Yeah, that part. I know, it's interesting.
Yeah, utero, because we pay attention to how like the mouth forms, and we kind of all come from our mouth, so to speak. Right. And then the formation of the baby teeth. So wow, I didn't recognize that connection between the kidneys and the ears. Very cool.
Right. Yeah.
Well, Dr. Means, thank you so much for all of this information. I know it's probably food for thought for a lot of people. And now we're going to start doing searches on the rest of these correlations. It's amazing how everything is connected.
I agree.
Well, thank you for joining us here today and for sharing your knowledge. And I hope to see more referrals with professionals from having this information. So thank you so much. And I hope you have a blessed day, and I'm sure we'll see each other again soon.
That's right.
Out there serving the community.
Absolutely. Thank you so much for inviting me. Bye.
Bye.